Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. So glad that you could tune in today. Our understanding of cancer is kind of shifting from classifying tumors primarily by the location in the body where the disease originated to underlying molecular biomarkers. Now, recently, for the first time, the FDA approved a therapy based on a biomarker. Our guest today is Dr. Luis Diaz, a researcher from the Memorial Sloan Kettering Cancer Center, who's helped to pave the way in understanding the role certain biomarkers play in cancer. And he's here today to talk about the science of biomarkers, the clinical utility of certain biomarkers, and how this development may provide some new hope to some of the millions of people who are impacted by cancer every day. Welcome to the program, Dr. Diaz.
Thank you so much. That really encapsulates what's happened over the past few months. The FDA has really come around and helped us reclassify what cancer is like.
So, first off, explain to us what cancer biomarkers are.
So cancer biomarkers are something that you can measure, whether it's within the DNA of a tumor or on the surface of a tumor, in the blood of a patient, or even at a CT scan, that allows us to identify a characteristic of that tumor that we may be able to use to our advantage to treat. So, for instance, PSA is a blood biomarker that we use to track prostate cancer. Mm-hmm. Or a mammogram looks for changes in its imaging to look for in the breast, identify what may or may not be breast cancer. So biomarkers aren't perfect, but they're the closest thing that tells us what might be going on with the tumor.
And are they extremely beneficial in the timely, proper diagnosis of certain cancers? Are these helping to alleviate misdiagnosis to some degree?
Yes, they help us diagnose cancers, sometimes very early, but they also help us track cancers. They tell us if a cancer is growing or shrinking from a therapy, and they can even more recently tell us whether or not a certain therapy should be utilized versus not utilized.
So certain biomarkers play certain roles in cancer research. There's one in particular, MSIH. Talk about this particular biomarker. What is it and how does it operate?
Yeah, so MSI-H stands for microsatellite instability. And what that means is that the DNA in the tumor has certain regions that are unstable and can get larger or smaller. And that's a biomarker for a tumor with what we call a high mutational burden. So what does that mean? Well, we know that tumors are initiated by the triggering of mutations in the DNA, and these tumors have an exceptional number of mutations. So MSI-H, or microsatellite instability, is a biomarker for a tumor with an exceptionally high mutational rate.
So are these biomarkers readily useful in all patients? I mean, we're talking about millions of patients with all sorts of different types of cancers. Are there any patients who are just not good candidates for utilizing biomarkers as opposed to the traditional way of identifying tumors?
What's interesting about microsatellite or MSI-high instability is that tumors that have this biomarker are found in about 3% of all cancers.
Okay.
And therefore, of the millions of people around the world who have cancer, about 3% of them will have this biomarker in their tumor.
These people that have this biomarker, you say only 3% of the millions of people that are affected. How drastically is that going to change their treatment option? Are we talking just early detection, or are we talking total shift in what their treatment would be?
So it actually means the following. If we had 100 patients with cancer and their cancer was metastatic, meaning that this cancer was lethal, that the cancer was going to kill them, about 3 to 4 of those patients would have this biomarker, and that biomarker tells us that they may respond to this new immunotherapy called Keytruda. And not just respond a little bit, but respond in a dramatic manner.
Now, Keytruda is something, is it recently approved by the FDA, or is this something that's been around for a while?
That's been around for a couple of years, primarily for lung cancer and melanoma and some other cancers. But this is the first time that we've been able to identify a biomarker that reaches across all tumor types, whether they come from the breast, the colon, the pancreas, the brain. If the biomarker is there, it doesn't matter where the tumor was born. It just matters if the biomarker is there. This drug, Keytruda, works remarkably well.
How is the test conducted? Is it an invasive test? You mentioned some blood and things of that nature, blood test. Are there any other ways that the test is conducted?
In this case, the test is done by analyzing the tumor tissue. So when you're diagnosed with cancer, they take a biopsy and they tell you this tissue is cancer or it's not. We take that tissue that's cancer, take out the DNA, and look for this MSI-H or microsatellite instability in that DNA.
So who are the patients that you would identify as, being proper candidates to be tested?
This is a remarkable thing. It's every patient with a solid tumor removed.
So 100% of the patients to glean the 3% that are going to benefit from this type of testing, yeah?
That's exactly right.
So how do you start the conversation with your healthcare provider if maybe he or she isn't as up on this biomarker as, say, you are, and now our listeners are? How do you start the conversation?
So it's a matter of, if you have a metastatic cancer that is not responding to therapy or has stopped responding to therapy, it is appropriate for the patient to ask, have you tested my tumor for microsatellite instability or MSI-H? Because there's about a 3% chance. It's not high, but it's also not zero, that you have this abnormality in your tumor, and that this would mean that you would respond in an exceptional way to Keytruda. And by exceptional, I mean in most cases the tumor shrinks, and in most cases the tumor shrinks and disappears for, at this point, over 2 years.
Is Keytruda used in conjunction with other therapies, or is it a standalone therapy once the tumor has been identified properly?
If you have MSI-H, then it's a standalone therapy. You don't need anything else.
Now, where can our listeners go and get some more information about Keytruda, about the Memorial Sloan Kettering Cancer Center, and MSIH as well? Yeah,
so right now that you can get more information on this therapy from the American Cancer Society at the website for Merck that discuss Keytruda and MSI-H tumors.
Well, Dr. Diaz, it's been a pleasure. Thank you for coming in and speaking with us about this subject. I'm looking forward to some more conversations with you.
Absolutely. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Luis Diaz, researcher from Memorial Sloan Kettering Cancer Center, who has spearheaded the way in understanding the role that biomarker MSI-H plays in cancer. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.